Listen, we're talking about hearing better. We're also talking about vocal issues you might be having and how this can all be corrected in the new year. Maybe these kinds of things are on your New Year's resolution list. Well, let me tell you, if that's the case, your next call should be over to Diversified Hearing and Rehabilitation Services. Dr. Sal Gruttadauria is back, and he has brought with him Delaney Greco, who is a speech pathologist who works there. And we thought this morning we'd talk a little bit about voice disorders and what can be done. So good morning.
Good morning.
Nice to have you here.
Hi.
We don't normally talk about voice disorders.
No, we usually
on.
talk about hearing problems, but we also have a full rehab service agency with physical therapy, occupational therapy, and today we're going to be talking about speech therapy and in particular voice therapy.
Okay, Delaney. So what is a voice disorder? What do you consider that?
Voice disorder is really any abnormal change in the way a person's voice sounds. Maybe it's the pitch, it could be the loudness, but generally it's the quality of the voice has changed for the worse. It could be sounding hoarse or breathy or rough. And if you have something like that that's been going on for 3 weeks or more, you should really see a doctor and get that addressed.
Because that could indicate that there's something going on in the throat,
yeah,
right?
Yeah, and it could be serious or it could be something benign, but either way, there's help for it and you're going to want to get that checked out.
And you would be that person over at Diversified Hearing, right?
Yes, absolutely.
Yeah.
So we usually have people see an ear, nose, and throat specialist first. They can look at the vocal cords and determine what's going on, and then we form a treatment plan from there. So whether it's vocal weakness or vocal hyperfunction, where people use too much muscle tension or too much effort when they're speaking, we kind of rebalance the whole system and make it work efficiently and easily.
You know, Delaney, Dr. G gives people a thorough test when they come in to see exactly what's wrong with their hearing. You must do the same thing when it comes to trying to really isolate what the issue is with a voice issue.
Right. So the first part of the test, like I said, is they see the ear, nose, and throat specialist. They use laryngoscopy. They view the vocal cords. They see what's happening, whether it's a lesion, polyps, or just muscle tension, and then they come to us. We will take acoustic measurements, audio perceptual measurements. We'll record their voice before and after, get their own self-assessment of what they feel is happening, and then we kind of listen to them and figure out what needs to be adjusted.
It's so nice to know that you can do this over at Diversified Hearing and Rehabilitation Services. And Doc, we've talked about the fact that other people sometimes notice if your hearing is starting to go. They notice it. It could be the same thing. Someone else, your spouse, your kids might notice if your voice is changing.
Absolutely. And you know, the thing to remember too is that a vocal change can be a medical issue, and you really need to have that checked out. You can't ignore that. You have to have it checked out.
Right. Delaney, in my case, I had to take speech therapy when I had my thyroid removed. Is that common?
I have seen that where there can be some nerve damage after surgery, and it can leave people with vocal paralysis or, you know, on one side or both. And so, you know, you really need to see the doctor for that because there is obviously surgical intervention. And we can do a little bit with therapy, but yeah, that's definitely a medical issue that you'll need to continue to follow up with your doctor.
Any other issues that can be helped with speech pathology?
Yeah, so with voice therapy in particular, I see a lot of structural problems, nodules, polyps, a lot of functional issues where people just use excessive muscle tension when they're talking. They may not realize this is actually causing excessive effort and fatigue and strain in their voice. And then there can also be neurological voice issues like Parkinson's disease. We work with people with Parkinson's to strengthen their voice.
And you know, it's interesting, Doc, because when people go in to have their hearing checked, that might be something you'll notice, that if they're having vocal issues, and we've got Delaney right there where you could actually say, you know, you may want to have that checked out, and we've got some people here that can help you.
We don't treat with blinders on, you know, we look at the whole person.
Fantastic. Diversified Hearing and Rehabilitation Services. I have to tell you, everybody, what's so nice is that there's an office near you. All you have to do is just pick up the phone and make that appointment. Even if you want to make that appointment for someone else, you're noticing that their hearing is becoming an issue, their speech as well. 9 locations now throughout Erie, Niagara, and Wyoming counties. Here's your main number. It's 871-9915, or do log on to diversifiedhearing.com.